Hello, I'm Dr. Elliot Hirshhorn of New Life Functional Neurology and Endocrinology in Greenville, South Carolina. We focus on helping patients suffering with chronic health conditions like thyroid disease. In this video, I'm going to discuss why you still have low thyroid symptoms even with normal TSH labs. Many people with hypothyroidism tell me that they still have low thyroid symptoms even though their doctor has said that the TSH levels are normal. They're trying to figure out why, but haven't been able to get the answers from their primary care doctor. There are two main problems that make this situation all too common. Number one, the TSH, or the thyroid stimulating hormone, the so-called gold standard in medicine to assess for thyroid function, is very incomplete on its own. Number two, the laboratory reference ranges used to interpret the lab values for TSH and other markers are too broad and imprecise. Let's talk more about these two issues in a little bit more detail. First, the TSH as a solitary test is insufficient to fully assess for thyroid function. It by itself, however, is the standard of care in medicine. Rarely is anything else additional ordered, even though a complete thyroid panel is necessary to get a thorough clinical picture in regard to thyroid function. I do a full, comprehensive thyroid panel to identify the exact underlying causes driving a patient's symptoms. There are over 20 different patterns of thyroid dysfunction, and only a complete panel can identify which particular patterns you may have. My comprehensive thyroid panel includes the TSH, of course, but it goes well beyond that. It also includes T3 and T4 in both the total and the free fraction forms, reverse T3, T3 uptake, free thyroxine index, and thyroid antibodies. These 10 markers are the baseline where I start the process of identifying the actual causes of your thyroid problems. Depending upon what patterns are found, there may be more extensive testing recommended to further refine the underlying physiological mechanisms driving your symptoms and an appropriate action plan to address your condition. Of those 10 markers, the two most clinically important for me are the antibodies. This is because the most common cause of hypothyroidism in the United States is Hashimoto's, an autoimmune condition. Most people don't know they actually have this, however, because the proper testing is never ordered as part of the medical standard of care. In fact, on many occasions, I have the responsibility of telling a patient for the first time that they have an autoimmune disease in Hashimoto's. And this is really bittersweet because on one hand, no one obviously wants to have an autoimmune disease, but on the other hand, once we have this result, we finally know what's causing the issues so we can properly address them to get the patient their life back. Secondly, no matter how many tests you have ordered, if the results are not interpreted properly, the information is not very valuable. Let me explain laboratory reference ranges. Take TSH, for example. The reference ranges for all markers, including TSH, are different from one lab to the next. In fact, I've seen the upward limit for TSH be anywhere between 4.5 and even 6.5, depending upon where you go. So the question is, how can this be? It's because each lab calculates the reference range based on the average values for everybody that got that particular test last year. It's really a bell curve calculation. And what they do is they stretch out the acceptable so-called normal range wide enough so that literally 99.7% of all people will fall inside that normal range. For those that know statistics, it's 4 standard deviations from the mean. Most people that go to the lab to get their tests done are mostly sick. So you're basing your health on a lab range that's calculated using a group of mostly sick people. There is a better way. We use functional lab ranges that are based on a healthier population, and the range is not as broad. This allows us to determine the health issues before they become full-blown crises. Think about it this way. If you're heading towards a cliff and you're blindfolded, when do you want to know that that cliff is there? After you've fallen over it? No. You want a warning. Functional ranges allow us to give you a warning about impending health problems. Remember, you don't suddenly become unhealthy as soon as you cross this arbitrary threshold. It's a gradual progression. Functional values help us to identify a disease in process of development rather than waiting until it qualifies for an actual medical diagnosis. So, the reason you may be feeling fine despite your normal labs is because either the proper testing has not been completed or the test results were interpreted improperly. Maybe you're just below the cutoff for a diagnosis, yet well on your way to dysfunction, so you're already experiencing symptoms. If you still feel terrible, despite having normal labs, and you want to know how I can help you, contact my office today at the phone number below to schedule a consultation to see if you qualify for care. Thank you, and have a great day.